before we get going, I just wanted to provide the standard reminder that we'll be making projections and forward-looking statements. These statements involve material risks and uncertainties that could cause actual results or events to materially differ from those anticipated. So please be cautious in placing any undue reliance on forward-looking statements. With that, for those of you who are new to Berkeley Lights is a leading digital cell biology company, really focused on accelerating the rapid development and commercialization of biotherapeutics and other cell-based products. And we do this because we believe in the future cells can become a dominant means, not only a dominant means or the primary means for manufacturing the products we need to live a scalable and sustainable life, but also a scalable and sustainable way to make those products. And the Berkeley Lights platform, which enables what we call digital cell biology, is a key component to drive that industry trend. And it's our objective to set the standard across the cell-based product value chain. Now, the markets that can be addressed by cell-based products are broad and huge. I'm talking about pharmaceuticals, new and sustainable foods, and industrial materials, to name a few. And even the small subset of markets that we operate in, such as antibody therapeutics, synthetic biology, and cell therapies, amassed more than $148 billion in end market sales last year, which will scale to over $250 billion within the next 5 years. But there are some real challenges making cell-based products. Namely, you have to know and understand how the cells will perform or behave in the end market situation. And what that means is that you have to functionally characterize tens of thousands of single cells in parallel to find that single cell which will make the products you need. And with today's technologies, that's hard, expensive, and often our customers, it doesn't result in them finding the cell-based product to make the cell to make their product. But at Berkeley Lights, what we do is we find the best cells for our customers. That's our business. And even though we're still in the early days of our company, we've amassed a customer list that includes 8 of the top 10 biopharmaceutical companies in the world, and arguably the most valuable synthetic biology company in the world. With that, Tejas, I'll just finish that on a brief introduction for the company.
Sure. Thanks. That was great, Eric. So maybe we'll just start with a quick second quarter update. I mean, you had a solid first quarter out of the gate post-IPO. Can you share some highlights on the trends you saw in the quarter and also provide an update on momentum since? And as you sort of like frame that, I want you to think about, what trends were like in April versus trends in June and, potentially since then in July and August. And then, the order book versus the installations, because I'm sure there was a gap there, in terms of getting new customers onboarded and your ability to do so because labs were closed. And then we'll take it from there.
Yeah, so I'm going to ask Sean to jump in and answer this question. Sean, go ahead.
Yeah, absolutely. Happy to. Yeah, so I'm not going to rehash, Tejas, all the numbers here, but,
sure.
We were able to demonstrate, direct sales revenue growth, recurring revenue growth in Q2, which was obviously a positive just given the COVID environment, right? I think from a macro perspective, as you asked, we're seeing a strong surge in CLD capacity, just given COVID and other antibody discovery work as well. And obviously this is how we win, in this market with our CLD workflow. I think from a longer term trend, we continue to see, infrastructure investments in pharma towards biologics, CMO investments continue to be off the charts. Obviously here, we enable many things as well, right? Multi-specific cell therapy manufacturing, et cetera. I think, continuing with the cell therapy, theme and market, characterization of the immune system, particularly with T cells, they're difficult to work with, and we're excited about the recently released products targeting T cell characterization for markets like, immunology, and cell therapy. I think beyond that, in terms of the momentum that we're seeing in, Q3, we're not necessarily providing an intra-quarter update today, but I think
sure.
As we move into closing out Q3, we look forward to sharing our results in November in our first earnings call.
Got it. Go on. Was that something you wanted to add, Sean?
No. Second part of your question.
Yeah, it was just around sort of, the customer activity levels you're seeing, and then, the gap between installations and orders, if any, in the second quarter.
Yeah, great question. I think, going back to the COVID question and the impact, we talked about this quite a bit in the roadshow. Customers coming back online at the end of Q2 was something that we saw. COVID in Q2 impacted our ability to really ship insurance because customers are simply shut down or not able to receive shipment, right?
Yep.
But like we said, and we continue on this, we did not see an impact on the demand side of things. So pipeline continues to build. I think, with respect to the sort of the academic versus biopharma, given most of our core business and our core markets today is biopharma and CROs, we didn't see as much of a slowdown probably as many companies that operate, purely in the academic setting. We've seen COVID-related activity and the disruption there begin to stabilize. It's interesting too, as we think about like the industries that we're operating in, they're still learning how to engage in this COVID environment and the restrictions that are still presenting themselves. But installs and training still, joint lab work development as well continues to be a challenge. But I think this is also an opportunity for us, right? Just given the fact that we can mirror, beacons at customer sites with our biofoundry, right? So we can support, we can train, we can assist customers remotely. I think that's an advantage that we have, with our platform.
Got it. That's great. And Eric, just going back to you, I mean, can you walk us through on that sort of COVID note, where exactly you participate in the potential upside and the response there? And then just how exactly are customers using your workflow to accelerate therapy and vaccine development?
Yeah, sorry, I had to unmute for a second, Tejas. So since the COVID outbreak, we've been working with multiple, both academic and commercial institutions to create, help them find antibodies or accelerate their vaccine development in the COVID space. And so there are actually multiple ongoing clinical trials right now with either antibodies or vaccines that have been found on the Berkeley Lights platform. And so, I think during the IPO roadshow, we shared with everyone that at the end of January and early February, 8 mice were police escorted across China. We were one of the first to find antibodies on the Berkeley Lights platform for SARS-CoV-2 in China. When patients came back to the United States with the Department of Defense and Vanderbilt University, we found hundreds of antibody therapeutic candidates with Professor James Crow at Vanderbilt. And actually, those antibodies worked their way through the system and are licensed now into AstraZeneca. They started phase 1 clinical trials 3 weeks ago with that antibody. On another, and so that's one of the clinical trials that's ongoing. Another one, which was the University of Queensland, had a vaccine subunit, a subunit vaccine that they wanted to get to market. Now, in order to get this to market, they needed to, this particular vaccine is manufactured in a mammalian cell line. And so in order to get that to market, you need to find the cells that produce the most vaccine. And that's actually the image that's behind me. Is these are the cells actually in the bright blue image here that have the highest titer and were selected for that vaccine. And so in a record 78 days, we went from vaccine subunit concept into clinical trials with the University of Queensland, Trent Monroe at the University of Queensland. And that started on the 13th, July 13th, they started the phase 1 clinical trials. And they're getting readouts now, and that's looking promising. And so at a high level, Tejas, the summary is that, we took a couple shots on goal. And to have a vast majority show up in clinical trials is actually really promising for us, meaning that, the selection criteria, the speed at which we're helping our customers select these things is really paying dividends for our customers.
And has there been a positive fallout from that in terms of the perception of the platform among a wider customer base? And are you getting more and more inbounds? I mean, there's about 250 of these therapy and vaccine candidates in the pipeline today. Are you getting more inbounds on that front?
Yeah, I think the more important thing, Tejas, is the world is starting to understand, right? The challenges associated with antibody therapeutic development and vaccine development. And the world is responding in a way that's saying, hey, these timelines are not acceptable. Why does it take 10 years, right? And the world is also learning that when we leverage technology to process biology, we can do things at unprecedented time points. I mean, we've caught up to antibodies. Some of the leading antibodies that are in clinical trials right now, Tejas, are antibodies that were repurposed for different diseases for this particular disease. But we caught up to those antibodies with specific antibodies specific to this particular disease. And I think that's important that, in the future, the world can respond much faster to these kind of emerging pathogens in the market. And so I think, what Sean was saying is I just want to put an exclamation point on it, is that, the general trend that we see is that the pharmaceutical industry is starting to invest in additional infrastructure to scale up the manufacturing of cell-based products. And as we go, into the future, what that means is there'll be additional capacity online. Prices will come down to make cell-based products. People will start to develop more cell-based product, which drives demand for Berkeley Lights platforms and workflows to help develop those new cell-based products in the future. It'll be a virtuous cycle as prices continue to come down, more products are served this way, more markets open up. So I think it's although COVID is just a terrible time in the world right now, I do think that we are going to make some lemons out of this lemonade globally as global citizens as we move into the future in making, products using scalable and sustainable methods using cells.
Got it. So just switching gears a little bit to the Beacon platform, Eric. One of the top inbounds that I've gotten since the IPO is just around who you could potentially displace in terms of these legacy workflows that customers use, and specifically, like, how exactly does a Beacon stack up versus say a single cell platform like 10x's Chromium. Can you just help us sort of think through that, because I think there is a little bit of confusion around how the platforms stack up and who exactly do you replace?
That's right. I mean, thanks for the question, because people, Tejas, do get very confused here, right? And I think it's best to think back, what are our customers really trying to do? Our customers are trying to make cell-based products to help humans, whether it's provide them with therapeutics, to provide them with food, right, to provide them with industrial materials, enzymes, et cetera, right? They really, we're trying to do these things to evolve the way in which we can make products into the future. And so what they do is, what we find is all of our customers, to make these products today, they're running what I would call methods that are executed in these labs. And these methods consist of multiple single points of equipment that are stitched together by PhD scientists, executed by either PhD scientists or research associates, supported by, laboratory infrastructure team members, and data infrastructure team members at these companies. Is actually quite an expensive thing, right? And so, again, focused on the cell-based product area, right? What we do is we take the majority of those pieces of equipment, we've integrated that into a single platform, right? And so, with that platform that we place into these labs, we provide our customers with a higher probability of successfully getting to their cell-based product, and typically on the order of magnitude improvement in overall throughput, right? And so that's what we do, right? That's kind of how we think about our platform. Now, let me get to the second part of the question, because there's a lot of confusion here. Like, is 10x, is it Berkeley Lights, right? Where does Twist play in this area? How does this all work? And what you're seeing unfold in the world is the new cell-based, right, discovery and development ecosystem. And in this ecosystem, you need to find sequences that you can use to transform cells. You need to then go buy those sequences so that you can do gene editing. And once you do the gene editing, right, then you've got to validate that the edits that you've made to the cell are creating the function that you desire, right? And so what Berkeley Lights does is we provide that functional testing. And we do that because cells, we don't know how cells are going to express the edits that we make to those cells. And so it's actually quite complementary. The more understanding we have of single cell sequencing with the 10x, it drives additional demand at places like Twist for making DNA, and then additional demand for Berkeley Lights to do more functional testing. And so it's actually very synergistic in terms of the ecosystem of how these companies work together. People are, should it replace this or replace that? No, it's complementary and providing different functions in that value chain. So hopefully it wasn't so long-winded that it was confusing.
No, it was actually very clear and very helpful. So Eric, on your point around, the Beacon being this box that essentially collapses entire sort of portions of a workflow and accelerates the process for your customers, you obviously have a marquee set of customers today. And yet, Do you think there's more evangelizing to be done in terms of getting people comfortable with letting go of those legacy workflows? Because, inconvenient and cumbersome and less efficient as they may be, there is a familiarity with it. There's inertia. There's, people are, wedded to their babies, so to speak, in terms of what they've created, in terms of optimizing the solution. How do you go about convincing them to make that leap of faith on the beacon?
Yeah, no, absolutely. I mean, with any new technology, you'll find technology switching challenges, right? I mean, you can do it for compute. You can talk about computers. You can talk about, internet applications. You can talk about all these things. Changes. It usually has non-zero costs associated with it, right? And so to change, you have to provide your customers with a compelling value proposition, right? And so at Berkeley Lights, there are some very significant value propositions we have. I mean, in the antibody therapeutic space, we have customers who have run, 10, 15, 17 hybridoma campaigns, found nothing. Run a couple workflows on a Berkeley Lights beacon and have hundreds of antibody therapeutic candidates, right?
Mm-hmm.
Aldebaran, for example, just published at PEGS. They ran head-to-head hybridoma versus Berkeley Lights, right? And we found between 5 and 50 times more candidates, right? That's not percentage points. That's hundreds of percentage increases in the ability to find things. So our customers are finding solutions that they couldn't find before.
Mm-hmm.
The same is true in cell line development. In cell line development, our customers are looking for the highest titer cell lines. And Catalent ran us in a head-to-head, and we found cells that were producing 3 times the amount of titer. Now, a 20% increase in titer in that space is like a $10 million savings in the manufacturing of that protein.
Mm-hmm.
And so, when you have these level of compelling value propositions, when you can show this data to your customers, you can get switching. Now, that doesn't mean that we can just show up and show data and customers go, well, I'm just going to throw out the stuff that we worked the past 20 years, 30 years bringing up, right? It does take communication, transition, and working the customers through that process. I think also we have to think about the switching cost associated with bringing technology, high levels of technology into, maybe where people were not using as much technology in the past, and helping them in that education process. So in Q2 this year with the COVID situation, one of the things we started to think about is how can we remotely help our customers come up to speed on our technology, both training them on the workflow and educating them about our platform. And so we launched what we call Berkeley Lights University. It's an online university where we teach our customers about some of the benefits of our platform, how to use our platform in different applications. And so there's a lot of work to be done. Now, I would say that's true in America, this kind of resistance to change in America and Europe. There's a new emerging market, which is the Asia Pacific market. In these particular markets, you're talking about, working with companies that they don't have that installed base, right? And the interesting thing is that they can get to state of the art without having to displace an existing workflow or infrastructure.
Right.
And so
they essentially leapfrog straight away to Berkeley Lights. Okay, got it.
Right.
That makes sense. Eric, on the point around direct placements for the beacon, I mean, it is an expensive system, and we'll get to sort of the Lightning and subscription placements in a bit. But in terms of direct placements, what do you think sort of about the long-term installed base? What does that number look like to you today? And then what fraction of these sort of potential customers do you think would need more than one beacon instrument in-house?
Yeah, so the long term, I know this is not a satisfying, and I'm not trying to be silly or something. The long term number is we'd have to talk about markets, right? Because I think if we talk about the markets we're in today, right? Antibody therapeutics market, we shared in the IPO process that we see a path to 3,000 placements, right? And in synthetic biology, we look on the order of 1,500 placements. In cell therapy, for only just a single indication, it would be on the order of thousands of placements. I don't even want to say that number. It's a big number, and that's for a single indication. And so, these are the kinds of numbers that we think about. But, the platform extends beyond those capabilities, right, into, other areas that would make those numbers go even larger. I mean, if you think about the number of workflows that would run in a cancer discovery, we worked through the numbers in the IPO window. It was like, over millions of workflows, and that's just for cancer, right? But there's infectious disease, there's there's inflammatory disease, there's all these other things, right? That we're not actually participating in those markets yet, right? Now, let's get to the multiples number, right? So currently, I'll tell you what we currently see is on the order of 22% of our current placements are multiples at customers. And one customer has 5 systems already, right? Which is well down the path for, when we think about large pharma customers having, on the order of 30 to 40 tools per placement in the future. And so I think if we do a percentage-based point, Tejas, on the number of customers, I would say it's probably 25% of the customers, total customer numbers, would have multiple units, with the understanding that 25% probably represents a very large fraction of the overall market, because these are where the big customers are. They
right.
live, and so customer numbers, probably 25% of our customers would have multiples.
Got it. And for that sort of incremental beacon placement among those larger customers, does the system essentially do the marketing for you in terms of, one sort of set of people essentially evangelizing on your behalf to their colleagues within the organization?
Yeah, I mean, we've got a situation right now, ongoing right now where, usually it requires a more elongated sales cycle to get, certain things across the line. And the internal team at this company is like, don't even run a feasibility analysis, just get the tool. And so, and when, I think that just speaks volumes for, the product capabilities that are being developed by the team members of Berkeley Lights. And so when you have your customers who are evangelizing for you, it's wonderful. But again, still, we're really, just in the early days of penetration into the market. There's still a pretty dramatic upside to even in the antibody therapeutics market, Tejas.
Sure.
I think it's still early days.
Got it. And then quickly on subscription and Lightning units, what's the early traction been like over there, Eric? I mean, obviously, both are relatively recent. And then, at the time of the IPO, you guys had spoken about sort of a 15 to 20% attach rate for each of those relative to your beacon placements. And the one question as I looked at the model was that why should this number, especially for the Lightning, not be a lot higher, right? Because if I think about Illumina and I think of, a NextSeq or a MySeq install base relative to a NovaSeq, it's much larger, right? And NovaSeq kind of like tops out at, 400-ish customers or give or take. So how do you think about that?
Yeah, so actually, since Sean is from Illumina, I think he's the perfect guy to answer this question. Sean, why don't you
No problem. I'll take it. So I'll just touch on first subscription and the traction there. I think is the first part. Yeah, I mean, just as a reminder, we launched the offering just before COVID hit, and now really we're marketing and selling this thing in earnest, right? I think one of the important considerations here is that the subscription access model for our type of product offering, right, is a relatively new concept. And so, it's going to have a certain adoption cycle. And so that's what we're driving towards and learning. And as we engage with customers, we continue to evolve the product offering as well. I think, we're still at the early stages, as I discussed. I think, we think this model offers a very compelling advantage to our customers in terms of just the predictability, the technology access, the software upgrades, and our programs around service and support, and also cloud-based services down the road.
Got it.
You asked about, I think, Lightning as well. In terms of the attach rate, I think that's sort of how you're modeling and thinking about these things and talking about it externally. And I think that's the right way to do it currently, because our initial sort of target market with Lightning has been our existing customers for assay development, right? And so there, the attach rate kind of modeling assumption makes sense. I think as we launch and deploy more and more workflows and app notes and protocols on the Lightning, specifically targeting the T-cell, market with cell therapy development and, things like that. I think we'll start to evolve how we think and model Lightning deployments.
Got it. Fair enough. And then, Eric, back to you on SynBio. I know you mentioned there's not that much that you can share on, the workflow that you bought down. But I think there's also confusion around what exactly that means, that you co-develop a workflow and then you buy it down, and then that sort of obviously pressured the partnership and feasibilities line, and that is still a good thing. So walk us through that sort of aspect of the business model, because potentially it's a very powerful aspect of the business model, but it comes at sort of a near-term cost, if you will. So walk us through that sort of aspect.
Yeah, we ultimately bought down the Ginkgo workflow because it gives us the opportunity to commercialize earlier. And, one of the things that when we entered into that $150 million deal with Ginkgo to co-develop workflows, right? Jason, of course, he said, well, I want exclusivity, right? And I said, no, right? I don't do that. And he said, come on, give me a head start. Right. And I said, okay, fine. We'll do a 1-year head start. And I said, well, I want, twist my arm. And I said, well, I want the ability to buy out of that head start if I see something I like. Right. Then I want to participate in the market, because the deal is Jason and I are working together, right, to simplify the process of engineering biology to make products into the future. We just are I'm super bullish on that being the way to manufacture things in the future. And so, that's part of his thesis at Ginkgo as well, with his, open wetware kind of platform that he has. And so what we said is, hey, look, we're going to make a big impact. If we find something that we're doing that's very well, then we want to get it to market. And so that's what we did. We bought that down. And yeah, there's a short-term payout, but, I think accelerating the rate at which we can get this technology into the market is going to pay dividends for, our global citizens as things get competitive in this space. And so, the opportunities in synthetic biology are substantial. But there's also widely varied, Tejas. Like, there's a lot of different things people are doing. And so what we are going to do is we are going to focus in our market segmentation on Food 2.0 and enzyme engineering as our leading workflow development areas in this space. And we'll work to, help move those forward with both the Ginkgo team, but also broadly commercialize those, as we'll announce those workflows in 2021, which is exactly what we communicated in the IPO roadshow.
Got it. Perfect. And then, Eric, in the last couple of minutes here, cell therapy manufacturing, very exciting. Clearly, there's a lot of demand there. There's also limitations to the current manufacturing approach. There's the centralized process and the decentralized process and so on. Take us through your sort of proposed solution to this current sort of state of play in the market, and perhaps provide sort of a high-level framework to think about the economics of the opportunity for you.
Yeah, absolutely. And in regards, I'm gonna first answer kind of our process or how we think about making the product, and then I'll get to the economics, right? For cell therapies, we see cell therapies as one of the most exciting and emerging modalities in pharma. And the exciting thing is it's not that they don't work. That's not in question anymore. The question is, can we make them, right? And the question being answered of can we make them, I think now billions of dollars are being invested into new emerging ways of trying to make things that are a little more standardized. But what about just making the things that we know work better, right? And so in the challenges associated with that, you'd have to be able to take cells from patients, process them rapidly, and get them back to the patient in an autologous fashion, right? And so when we look at what we did in previous markets, in antibody therapeutics, antibody discovery, we take cells from human patients, we find the best cells for a therapeutic, right? And then in our cell line development workflow, we take edited cells onto the chip, we expand them, and while we're expanding them, we're characterizing them, making sure that they're, achieving the phenotype and performance characteristics that are desired. Those are exactly the two characteristics that you need in this market. And so, we believe that all of these things can happen with patient cells being modified for a cell therapy on a platform that we have prototyped. And we believe that this can operate at the point of care. And if it operates at the point of care, there's some pretty significant advantages there for our customers. And so with our capabilities right now, we're helping our customers develop safer and more efficacious cells, which will lead to smaller doses. And we've seen doses come down. It was tens of billions of cells, billions of cells. Now we're seeing cell therapies at 100 million cells, right? And that's over the course of 2 years, so that can go down further. As that goes down, it leads itself to this more automated manufacturing process, and finding the right cells is critically important. And of course, that's what we do. We find the best cells. Right. And if we can do that, then we can fold this into the shortest vein to vein time for customers.
Got it. With that, I think we need to wrap up because we're actually a minute over. But this was fantastic, Eric, Sean. So thank you both for doing this. I really appreciate it, and we'll talk to you soon.